Sun. It's the sun damage, and it's the sun damage we've had as kids. My patients will always ask me, that means I don't need to wear sunscreen anymore, and the answer to that is no, you still need to wear sunscreen, because the damage can still happen. It's mostly from the sun damage. There's some genetic abnormalities that we have that we've been born with that predispose us to not being able to repair the damage that we get from our environment. Most people, it's just from the sun. Patients that have had a lesion that they've had since childhood, sometimes they're not as worried about those. But when those areas start to change, so they become pigmented, meaning they become brown or they become black, sometimes they even lose their pigment to become white. Those little areas we become a little bit more concerned. Or that area that they've had for a while begins to bleed. They always pick at it because it's just constantly bleeding, never healing. Those areas we become a little bit more concerned. If it changes in its characteristics, so something that was very described circle now becomes very ill-defined, those we worry about. The new lesions on in the head and neck area that are not healing, sores that just don't heal, we become worried about those as well. Biopsy. So typically, if the patient hasn't come in with a biopsy here, we will perform a biopsy on highly suspicious lesions. If it comes back cancer, then how we treat cancer is different for each type of cancer, but basically you have to treat where the cancer started on that skin, and sometimes you have to treat the lymph nodes that have the highest risk of having cancer in them. And so we discuss all that with the patients beforehand on what kind of surgery they'll need. I think the biggest advice I can give is just people being aware of their own bodies, and if you suspect something, call. Don't wait on it. The problems that we have is that a lot of times people wait and wait. Well, it doesn't hurt. Cancer typically in the early stages it's not going to hurt. That's why it can grow. And if it hurt, people are going to go to the doctors right away. I always tell patients that that's why we're here. We're here to make sure that if you do have cancer, we treat it, and if you don't have cancer, we're still here to take a look at that and say, hey, I wouldn't worry about that. That's why we're here. Utilize the people that are part of your life. Now, if you've had cancer, if you need cancer treatment, we're there to make sure to help navigate you through that process.